Hey, good evening. We're live.
Good evening.
Good evening.
I'm Dr. Monique Gary, aka Dr. Mo. I am joined with my co-host, Ricky Fairley,
Hey, everybody.
and our fantastic breastie and guest, and my lovely soror, Dr. Cordai Dakota. And you are joining us for The Doctor Is In. Ricky, tell them who we are.
Doctors in. We are your breasty besties. We are here to talk today, and we're going to talk today about when the provider becomes the patient.
Yeah.
So here, Dr. My story, and then we have another guest who's going to be joining us in a few minutes, and she's going to share her story. So Monique, have you had any patients that were doctors?
I have, and I've also had doctors' mothers and parents as well. And you know, when the provider, when the doctor, when the nurse practitioner becomes the patient, it is always it's always a stressful time for the doctor providing care, because we know that there's a level of questions and expertise and an understanding that we need to provide, but we have to balance it with understanding that when we're on that side of the table, you're a patient. You are a patient first and foremost. And that means bringing all the compassion. It means not assuming that everyone understands everything. Just because you're in medicine doesn't mean you're in oncology spaces and that you understand what's going on in your cancer journey. And we have to remember not to take that for granted. And so, you know, it is always a challenging thing. Having been a patient myself, having surgeries, you know, as recently as the last 7 or 8 months ago, it is, it's definitely an experience, and it's a humbling one. And so I want to go right to my friend and my soror to let her tell her story about how she, as a podiatrist, became a patient and what it's done and how it's transformed her inside and outside, and with advocacy and everything in between. So take it away.
Good evening, everyone. My lovely, lovely soror Monique Gary, the doctor, and my new friend and breasty buddy, Ricky Farley. Thank you guys for having me. My story was a whirlwind. I have had non-cancerous tumors in the past, known as a fibroadenoma. I had one removed when I was 16. I had another one removed during my residency and took my boards and passed them a week later. So that was great.
That's awesome.
And then in 2017, I was diagnosed with another one. Okay, didn't want to have surgery, was busy, you know, doing things, working, taking care of patients. 2018, I called my OBGYN, who's my very good friend, Nicola Pemberton, and said, you know, it's uncomfortable, and was having a meltdown because I felt pain, and I was just about to round at St. Barnabas Hospital and having a meltdown in the parking lot with doctors like, and she calmed me down, called the breast surgeon, Margaret Sacco, and that's how our journey began. I had a fine needle aspiration. It came back. They were negative. So, okay. I had always been doing mammogram. I'd always been doing ultrasound. In 2019, I delayed it, I admit, by maybe a month or so. I was going to Martha's Vineyard, and I figured I'll do it when I come back. I did it. And this time, the results were abnormal. I spoke to my mother. She said she's had one before, abnormal, no big deal. So I blew it off and said I'll do the biopsy the day after Thanksgiving. So I figured I'm not taking time off for this. I'll have the weekend to recover, no problem. You know, and unfortunately, that Tuesday, 12/3/19, as every breast cancer patient knows that their date, my breast surgeon, Dr. Sacco, called, and I said, oh yeah, you're calling to tell me about the fibroadenoma. Yeah. I'll take it out for the new year. Then I got the phrase, no, sit down. And you know, when you hear sit down, you don't want to sit down. And she told me I had breast cancer. I can't even tell you what, I'm sure Ricky can identify. I don't know what went through my mind. I was like, what? But it clicked because I started crying. And she said, I'll be here until 4:00. Don't worry. And bring whoever you want. So then I started bawling. My staff members have never seen me like that. I'm boisterous. I'm nice with people. My colleague came in speaking English, French, Spanish. She knew what to say to me. And I told him what my diagnosis was. And he said, the first thing he said is, you're going to live. And I think I needed to hear that because I was in meltdown mode. Went that evening, late afternoon, with my sister, who's my best friend in the world, and my OBGYN, who's my bestie, and we got the diagnosis. And the treatment then was a whirlwind because everything went super fast for me. And I started chemotherapy with 6 rounds of TCHP, which started on the 20th of December.
Can you explain that? What's TCHP?
Absolutely. So TCHP, Taxotere, the devil, carboplatin, the other devil, Herceptin, and Perjeta. And I'm sure, Monique, you can elaborate more. This is your specialty. But when you're diagnosed, you're looking at your receptors. I am HER2 positive, ER positive, PR positive. The ER for estrogen, the PR for progesterone. Mildly positive, but still positive. When they look at those receptors, they're trying to figure out what's the best form of chemotherapy for you. And that's what I got. And I had 6 rounds every 3 weeks. In addition to that, I also have tons of allergies. So I had to be really careful of what I was on.
Can you stop for 1 second and just explain to people that may not know a lot about breast cancer that there are many kinds of breast cancer?
So many.
It's true.
Can you break it down kind of a little bit when just people understand?
You know, the simplest ways to do it, because I'm a very, I use a lot of food analogies. So anybody, if my patients are watching, they know that I'm going to start talking about food, and I apologize in advance if I ruin food for anybody, but the most relatable thing that we all know is food. You know, and so when we talk about the types of breast cancer, there are many types of breast cancer. The 2 most common types are ductal and lobular, and ductal being the most common. So I tell my patients when I first see them, and I draw out, the duct is like an empty paper towel roll, you know, and it's lined with a layer of bubble wrap on the inside. That's a breast duct. It's lined with cells that are all uniform and fairly normal. And what happens in breast cancer is that bubble wrap, those cells become abnormal. And once those abnormal cells fill up the duct, you now have a stage 0 breast cancer, or we call it DCIS, in situ. If that duct breaks open like a can of crescent rolls, you pop the can and the dough pops out. Even if it pops out that much, that is now what we call invasive breast cancer. And those surgeries are different because when the duct breaks open or the lobule breaks open and the tumor invades the surrounding tissues, we then have to do a surgery to check the first place it would go, which are the glands under the arm. That's the lymph nodes. So something treats the body and something treats the breast. Something treats the breast and then something has to treat the whole body. So surgery removes a tumor or removes a breast. If we leave breast tissue behind, radiation or external beams, x-rays treats the rest of that breast, but something has to treat the whole body, and that's where medicine comes in. So how do we give medicine? Well, either by a pill by mouth or something through an IV or through a port. And what determines that are those hormone receptors that my soror, Dr. Descoteaux, is talking about. Dr. Descoteaux. Dakota, Dr. Dakota. I want to call you something so exotic.
I love it. Everybody wants
to. Dr. Dakota is telling us about these receptors, right? And the easiest way to think about the hormone receptors are like, I say toll booths on the PA Turnpike, because I'm a Pennsylvania girl, but you can say the Jersey Turnpike, you say the freeway, and there are these stations or places where the signal or the dollar hits the cell, and if you pay the dollar, you get to go through the toll, and then the cells grow or proliferate. So if we find the receptor for estrogen, estrogen's your dollar. It hits the cell, and it enables new cells to grow or proliferate. If we give you a pill, we can take away your dollar so you can go through no more tolls. If you don't have those receptors, like triple negative breast cancer, for example, you're in the easy pass lane. Taking away your dollars is not going to help because you're not using dollars. You got some other signal that's making you go through the express highway. And so that's how we figure out what types of medicine people get. So when you say HER2 positive, you had the toll booth or the receptor for the HER2, and that has a very targeted medicine called a monoclonal antibody, Herceptin, trastuzumab, Perjeta, pertuzumab, and those are targeted to shut that receptor down because that used to be considered a very aggressive type of breast cancer. And so it's not as aggressive anymore because the medicine is so very targeted to those cancer cells. And the treatment, though, as you know, is not just you get a couple rounds of chemo and you go to surgery, or you do surgery and a couple rounds of chemo. That's a treatment that's once a month, once every 3 weeks for an entire year. So we want to talk about that too. How are you doing after? Oh, wait, you got to keep going. Tell us more about your journey. I'm going to shut up.
No, I love it because it's your specialty and you broke it down excellently. So I started chemo 12/20, And I went in, well, let me say this. Anyone who goes through cancer needs help. I'm type A personality. I'm an AKA, right, Monique? I can do it all. And I was so blessed to have my sister from church, from Abyssinian Baptist in Harlem, Robin Martin, who came with me. And because there was no way. So when I went for the first time, I had my port in, which was raw. I had the port only put in 72 hours in prior because they were doing everything like, and so it's already sore. They're supposed to put a topical cream, lidocaine, prilocaine, to make the area numb. I forgot that completely. Went in, and now they want to hook me up. They hooked me up, and it hurt. So I hate being stuck. I'm a surgeon too. I do foot surgery. I hate being stuck. So that had me already on edge. My blood pressure probably shot up. When they began just giving me fluids, I was having shortness of breath. And thank God, again, advocating for oneself. I told her, the nurse, I said, you're going to take this out right now, or you're going to change your rate. She looked at me like, I said, pull out an ID. You're going to take this out right now, or you're going to change your rate. She changed her rate. She called the doctor, who's a colleague of mine, and she came in mightily row and laughed and said, yes, how do you feel? Much better. For me, I have a lot of allergies, so I had to be seen by an allergist, immunologist. Maybe not everybody has to do that, but because I was so nervous about having a reaction, my allergist, immunologist, Ann Maitland, actually was one of the best in the country, my friend, put me on protocols pre, during, and post. So I was on steroids, I was on Benadryl, I was on a lot of things that a lot of people probably didn't have to go through, and was high after each surgery. But I survived it. Was I sick? Never throwing up, diarrhea like crazy, dizziness, nausea. Chemo number 4 was the worst. I had to see GI because I thought, I'm not gonna make this. And just having a great team of physicians and a support system of friends, my sorority sisters, my family, friends, was everything.
So where are you now in your journey? And then we're gonna come back to you in a second, and we're gonna let Shakita. Do you go by Nicole?
No, it's Shaquita.
All righty, we're gonna let Shaquita.
Nicole is my middle name.
Okay, perfect. We're gonna finish with Dr. Dakota, and then we're gonna come to you and let you tell your story. So you finished chemo, and then
I finished chemo. I had an MRI. The MRI, as Monique, I lost my mind because they were questioning if I had another satellite nodule, meaning another spot of cancer in my breast. You were fantastic and talked me off the ledge, because I was on that ledge like, I'm gonna jump. This is insane. And you were like, no. Because I had literally the lump of my tumor was something that I could feel. It was very palpable at 12 o'clock, which is in this area. And it shrunk. And I remember I couldn't feel it. And I said, nope, it's in my mind. My oncologist, she, examined me. She's like, we can't feel it. So when the MRI came, I was like, so I had an MRI guided biopsy of the area, which is painful. And it was negative for it being another satellite area of cancer. I had a lumpectomy with some plastics, with a wonderful plastic surgeon done on the 18th of May, the day before my birthday. But, great. And my pathology came back negative, that it was a clean pathology, which made me ecstatic. I cried. So currently I finished full chemo. I am on hormonal chemotherapy, which is for the HER2 positive portion, which is the Herceptin Perjeta. And I am also doing radiation, which I am on week 2. How do I feel? As everybody keeps asking me, how do you feel? How do you feel? It varies. I mean, I wake up some mornings and I'll have nausea and want to roll back over, and that makes me more nauseated. And other days I'm ready, I'm in it to win it. I'm working out. I, will walk. I will do some beach body stuff. I will do dancing. And then other days I'm like, look, not today. And I just take it one day at a time.
And that's all you can do, for sure. And we're going to circle back to what has changed in terms of your thought process about breast cancer care and how you're doing your advocacy work and making a difference from your story. But I want to touch bases with Shaquita Estes. And we had the chance to get acquainted when you sent me a copy. I have it right here of your book. Absolutely. Mohair Don't Care. And it's so timely. A patient asked me, how do I talk to my kids about breast cancer and about a new breast cancer diagnosis? And you had messaged me right before that. I said, I got just the thing for you. And so I want you to talk to us about your journey, being in healthcare, being a provider, and tell us, just sort of where you are in your practice and anything else you want to share.
Okay, well, my name is Shaquita Estes. A little about me. I am a wife. I've been married 21 years. It'll be 21 years actually in November. We have 2 children. So I have a son who's 17. He will be a senior this year. And then I have a daughter who's going to 4th grade, my co-author, Miss Lexi. So I was diagnosed with triple negative breast cancer back in September. I can remember the date to this day, September 12th, 2018, and it was devastating. I'm also a pediatric nurse practitioner. I truly believe in God, but I feel like I was called for this assignment to help others. I got the news actually the day I was working. I missed a phone call earlier that morning, thank God, because my day would have been completely ruined. And as I was walking out my last patient's room that day, I got the call again, and all I heard, the radiologist say is, Ms. Estes, do you have a pen and paper? I need to talk with you. Can you sit down somewhere? And as I stepped into my room, my other room, all I could hear, it was almost like wonk, 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 because I was just in shock and disbelief. And she says, Miss Estes, we got your biopsy results back. You have triple negative breast cancer, well, really just breast cancer, and it's called infiltrating ductal carcinoma. So for those that are on the line or maybe watching, that means that it was in my lymph nodes. And so, after further biopsy, and then we found out it was triple negative, which was also like being another slap in the face for me, because that means that all my receptors were negative, my hormonal and the HER2, and it just can be very tricky for triple negative. So it was of the right breast, and I ended up having a right mastectomy. And prior to surgery, my doctors actually had me go through chemo first. So I did 6 long, hard months of chemo with what people call red devil. I don't like to call it the devil. I said it's the blood of Jesus, and there was only good things going, but there were a lot of side effects of the Cytoxan and the Adriamycin, let me tell you. Ones that I had never prepared for. And then from there, I did 33 consecutive days of radiation treatment, which I am still kind of reaping the damage from, because they burn me from chest wall to chest wall. So a lot of lymphedema, a lot of pain, and especially because I had my lymph nodes removed. I had 8 lymph nodes removed. 3 of them had cancer in them, and then from there I went on to surgery. So it's just been a tedious process. And again, like I said, from the day one, and after I got over my pity party session, I called in the troops. I got my girlfriends, my best friends on the line. And I said, okay, listen, I'm gonna say this one time. I'm not gonna keep repeating myself. And we just got on the line. We prayed. I went into my closet, my war room, and we went to just praying. So I called them my Tata troop. They're my special group of best friends. And then we just pulled in my immediate family. And then the support system just started growing by days. Like you, Dr. Corday, I had my sorority sisters, my line sisters, everybody just has been.
Shaquita,
I'm sorry.
What sorority?
Say that
What
again.
sorority?
Oh, Delta Sigma Theta. You see those
She said,
earrings,
look at her
right?
earrings. She said, look
That's
right
right.
here.
Look at exactly. So, you know, everybody just pulls in, and through this traumatic experience for me, what Dr. Monique was sharing with you guys is that my daughter and I, we had such a hard time dealing with hair loss. That was one of the biggest things. And I know some people say that may be vain, but for me, I had a lot of hair, luscious curls, natural. You know, I was the type of girl who went and got her hair done every 2 weeks. So it was really important for me to keep myself up and, you know, teaching and showing my daughter that I'm doing my hair, I'm putting on makeup. I didn't realize how it was affecting her as well, right? So now you see mommy with all this hair, and then it started just falling out pretty much between my second and third chemo. As the doctor said, I went in with chemo 1 with all this hair. By chemo 2, it just was falling out in patches. So I decided that, you know, what I could have control over, I was going to control. The things I couldn't control, I wouldn't worry about. So I went and had my hair shaved. And then I started wearing wraps. As you can see, I started wearing wraps prior to losing my hair because I was not quite ready to share with my colleagues and have everybody in my business. So I just was proactive with the hair wrap so it wouldn't be so obvious when I started to wear them on a daily basis. And from that, we have written a book, a children's book, which I am so proud of, my daughter and I. And one day she just really came home and she said, you know, Mom, there it is. No hair, don't care. It's a great story about just really having some open and honest conversation with our children. I find that when I was diagnosed and I was looking for books for my child, there were no books that look or represented African American women. And so I said, there is a need, and I am about to fulfill that need. So she just kind of ran down all of things that I had been through and like clockwork. And so the book is written through her eyes as a 7-year-old or 8-year-old. And I feel like we did an excellent job on just sharing our journey. And so now I want to share that journey with others. And I felt God telling me, this was never about you, Shaquita. This was always about helping other people and showing people your strength, your faith, you just sharing the word with others about how you walk through this journey and find your purpose in life.
I love that. I want to touch on something that you talked about, you know, losing your hair. And I know that all women who are facing chemotherapy, especially Black women, they understand that hair loss is a part of it. Chemotherapy targets the fastest growing cells in the body. So that's hair, brows, lashes, nails. That's your GI, which is why you get nausea, because the intestinal cells turn over every 7 days. Your red blood cells turn over. And so your bone marrow, you get anemia. But I want us to go around round robin, and you three breasties, tell me things that nobody told you as a Black woman with respect to your breast cancer, stuff that people did not tell you or offer you or really give you maybe the same consideration as others. Because I know Dr. Cordi and I, we got a list, we got a running tab, and you've been doing some research. But, you know, with respect to those things, what are some things that you wish you had known or that somebody should have talked to you more about?
Absolutely.
Well, me,
so I was given information on CoolCap.
All right.
CoolCap looks like a helmet. It's hyperbaric oxygen. Hyperbaric oxygen helps preserve blood flow, increase blood flow, and cell turnover in a healthy way. And it was supposed to, quote unquote, preserve up 50 to 60% of hair. What they don't tell you, because there's no studies on African American women, is what type of hair. So everyone knows who knows me well, I've modeled for Turning Heads back in the day in Harlem. I'm a hair person. I'm on Facebook for my current salon, Sultry Scissors. And I love my hair. I have a short cut, and the top was relaxed or straightened, and the back needed to be touched up. So it was completely natural. When I got diagnosed, the first thing I was told by my hematologist, who's part of the oncology group, Charlize Pont, good friend, you cannot relax your hair. Excuse me, what? And you cannot put extensions. So I was like, what am I gonna do? So I got a wig that I bought, human hair, had it cut by my stylist, Tamika, and was wearing that. But I'm not a wig person. I don't like anything on my head. What happened happened is just as she said, second going into third chemo, I had my mom braiding the top and leaving the back natural and the top was growing out. And I took a shower and I felt like my hair or head felt very heavy. And all of a sudden I went to wash my hair and there was hair in my hand. And I literally was like, and I showered and I came out and there was hair coming out and it started to clump, the relaxed hair. And I could not get a comb through it. So I had to start cutting what was still attached. I literally looked like George Jefferson because the whole front and sides were gone. I think I had a nervous breakdown. I got to my parents' house. My father was like, you know, what's going on? And I told him, dad being dad was just like, isn't that supposed to happen? So he got the side eye, but you know, he's a man. So I went to my mother and she calmed me down and told me the famous thing from my favorite artist, India.Arie, you are not your hair. And we can work with this and you need to see your stylist. And I wear a lot of African wraps too, Shaquita. I'm the queen of it. So I was a queen and I felt queenly in it, even though I still felt like I'm missing something, my hair. And I had to really separate that from me being a woman versus this is just cancer. So CoolCap is not covered by insurances or partially covered by it. I've even spoken to my oncologist that we have to have more studies for African-American women. It'll work if your hair is not permanently colored, maybe. It may work if you're not relaxed. But if you have any of those two things going on as a Black woman, your hair is gone. And $2,400 out of your pocket is something that you should know prior to dishing that money out. So, and your lashes, your body hair, and what have you. So listen, I lost.
I'm glad you were offered it though, right?
Yeah, and I got offered it, you know, again, being a physician puts me in a unique perspective that my colleagues look at it as, my colleagues cry on me, boo-hoo bawling, because it's patient versus she's one of us. So I'm getting all the information that unfortunately, you know, our sisters are not getting. That, you know, I have a friend right now who works for MSK. They didn't even tell her about CoolCap, and she's an employee of MSK. So my point is that's Sloan Kettering for those who don't know. But my point is this information, good information, has to be disseminated to all women. It can't be just because I'm a physician, I get this, and someone else does not. That's why I'm on here.
How about you, Shaquita? Other things that you wish you had known or that weren't discussed with you, whether it's reconstruction or survivorship or any spectrum of things?
Yeah, I mean, the hair part, I was told about the hair cap, but I opted because they couldn't show me that it was going to save my hair. So I opted not to even do that. I think one thing that I wish my doctors, and I don't know that this is really versus African American versus any other type of race, but I definitely feel like intimacy, especially if you're still married, that is something that needs to be discussed because, at 40, being diagnosed at 43, I'm still supposed to be vibrant and, all of those things with my spouse, but yet chemo had sent me into an early menopause. And so, I think having a low libido and knowing that that's a part of it is natural and it's normal. It doesn't, happen for everybody. Everybody's intimacy and your libido, all of those things will change. And that's something normal. Like I shouldn't feel abnormal because that happened. So I think I wish that doctors would talk more about that and how to try to overcome that because that can put a burden on your marriage. I thank God that I have an understanding husband and you find other ways, cuddling and other ways to meet those needs. But I feel like that's something that should be discussed up front and not wait till somebody comes around to tell you as the patient, but share those different things.
Mm-hmm. How about you, Ricky?
So I think my situation and I guess what Shaquita, I have triple negative, stage 3A. I had 7 out of 10 lymph nodes removed. But my doctor had only had 2 cases of triple negative before me. She was 38, she was pretty young. So she didn't really even know much about it. And both of the women died after 9 months. So I felt like she just didn't know enough. And so when I started asking questions, well, what does triple negative mean? Whatever, she didn't know enough. She didn't even know any stats about such. So I said, you know what? Me, you, and you need to go get some help because you don't really know what you're talking about. I definitely know what I'm talking about. And we actually ended up going to Emory, to Ruth O'Regan at the time, who was a triple negative guru, to get some help. But at least she had the wherewithal to want to be educated about it. And so she went with me, which is pretty unusual, but she wanted to learn. She was young, but still she basically told me I had 2 years to live because her relationship with triple negative was so limited. That's what she had seen. And she basically said, go get your affairs in order because you're going to die. Like, go talk to your family. So, just even like a doctor.
Oh, God.
And then when we found out about it, and when I found out that it was very much a Black breast cancer, that it's very prevalent with Black women, I said, I need to go talk to a Black doctor that can really school me. And then I started to meet other breasties that could help me. But just the lack of knowledge and I still think that this was 8 years ago, but I think this still happens today. People don't know about triple negative. And I used to wonder, okay, well, why don't we have any drugs? Why are we going to die? Like, what is it about our disease that makes it different? So I think one thing that would be really good, and I'm trying to work on a little bit, is even when they give you the list of side effects, they give you that stupid piece of paper. It's like, this long piece of paper, nausea, dizziness, tired, whatever, this list. It really, you can't even like really understand what those words mean, and what it really feels like. So I really want to develop the Breastie Guide to Breast Cancer and describe that from a perspective, from a patient perspective. Like, what does the nausea really feel like? And we know you can say the word nausea, but what does it mean when your head's in the toilet uncontrollably or whatever? Like, and try to describe all these side effects and symptoms from how it made us feel. And so I think it's really important to know our version of it, because the one on the paper was written by a scientist or a doctor, somebody who really didn't go through it, and I think, absolutely. And maybe it's a breasty doctor like you guys, or medical professional that can help do that, because we have a different way of looking at it once you've been through it, and I think we have to sort of tell the story from our perspective. It would help people a lot. So
how about radiation? What did you know and understand about radiation before you got radiation? I just did a talk with Living Beyond Breast Cancer, and we talked a lot about skincare and about the lack of information as it relates to Black skin, to Black and brown skin, and some of the side effects and some of the things that help you to feel better, skin creams, all the things. Like, did you feel prepared for radiation?
For radiation, I didn't know. It's ironic, like medically understood radiation, obviously. I was like, okay. But, emotionally and as a patient, and that's the hardest thing being a physician, because you know too much, but you're like, okay. And I go in like, hey, everybody, cheers. I'm going to see you every day. But I didn't know my radiation oncologist. She's wonderful at Overlook. And she sat me down literally for an hour. And we went through everything on my mind. So I felt, again, being a physician, I felt comfortable. However, what happens in radiation? And I'm only 2 weeks in, so I'm sure Shaquita and Ricky are going to give you more information than I'm going to give you. Hyperpigmentation of your skin or darkening of your skin, that has started. It's not horrible because, I have a little vanity. I'm a woman. But yes, that's happened. I was concerned about infection because I also had plastics done in my area where I didn't need an implant or anything like that. And they're saying that, no, I'm doing fantastic. That's just thickening of the soft tissue due to the plastics. However, when I started radiation, I wasn't having nausea on the Herceptin Perjeta by itself. I've had a couple of those prior to this. The radiation has made it where literally the week of chemo, I'm going to have nausea every morning. Nausea enough that builds up. It'll be day 1, maybe at a level of a 4. Day 2, it's a 5 or a 6. Day 3, I'm going to need to take some medication. And part of me wants to be like, no more medication. I'm sure Shaquita and Ricky know, you just get sick of it. Get sick of taking stuff. And you're just like, I'm done. So I was drinking the ginger tea. I'm West Indian. I had soursop leaves, and those things help. But it's rough in a sense that, they tell you might be tired. And I don't nap. But Monday, my parents saw me and I went home and I was gone for an hour and a half. You could not move me from the bed. You could have hit me. I probably wouldn't have felt it. So that's what I've been experiencing.
Yeah. For me, radiation, I was tired a lot. And so the other thing I didn't share is that I literally I worked through chemo my entire 6 months. I never stopped working. And then I took off the period for, my surgery, and then they make you wait 6 weeks, and then I had radiation. And I still went back to work after that, right? So I was extremely tired. So, I mean, like you're saying, I would come home from work from 8-hour, 9-hour shift, take a shower, put on my pajamas, and literally get in the bed and fall asleep, So that was the biggest thing for me. Hyperpigmentation of the skin, definitely. And as you heard me say before, because I didn't have extenders in or anything, I've literally been burnt from chest wall to chest wall, which now I'm having, some opacities that show up on, my CT scans and things that I'm having to watch. Literally, I was burned really bad. So it left an imprint there, for me, and it took a while for that hyperpigmentation to go away. Like you, my radiation oncologist has been excellent. She really prepared me as far as skin emollients and things to put on my skin. And then me just kind of working in dermatology, asking some of my colleagues, some of my African-American colleagues to recommend some things. So I did buy a certain brand of products. I think it's through Avene. So there was like a cooling spray as well as like a skin emollient that I used a lot of. So I was prepared there, and in respect of knowing that the skin was going to change. However, I didn't realize the intensity of how it would hurt. So even now, afterwards, having a lot of intense numbness, tingling, all of those things are very much alive and well. And so those are the things that I felt like I wasn't prepared for. And I'm sure that varies from person to person, but it's a real thing. So I never, when another breastie tells me that they're hurting in that area, I can definitely relate to that. And so I say to doctors, never undermine somebody's pain level when they're telling you that it hurts. Because it's very real. Sleeping on that side for me is difficult. No one told me that. So just different little things like that can make a difference in knowing if you are prepared beforehand, that you may have to use extra pillows over there, or, those kinds of things. So my sleep has been very much disturbed because again, the pain. I had such bad neuropathy too, from the chemo and the Taxol and the adriamycin, that I just ended up having to take gabapentin, and I even take that now for the numbness and tingling and the lymphedema of my right side. It is definitely a real thing for me, and knowing how long that really lasts for a person is just, I just can't fathom, a person going through that, because at some point you do get tired of taking a lot of things. And it's just like, I'll just work through that pain. I'll be strong and just work through it. And I think that's something else with African-American women. We're taught, and I know for me, my mom raised really strong girls, but we're taught to be strong women and not really knowing when to ask for help and use things to help us.
I just wanted to say something to you, and because Monique brought that up about, and you were talking about self-care, which you're alluding to. Unlike you, I went part-time from the beginning of the year. I just fatigue and treatments and keeping up with everything and patients. I was like, I'm going to lose my mind. And I needed that. And that was the best decision I ever did. I tell anybody, if you don't have disability insurance, either on your own, which is your best, even if you work for a group or a hospital, you should, because it took care of me with not a care in the world. And then when COVID came out, as we're both doing this through COVID of all crazy things, my medical oncologist took me out of work from March 16th. I'm actually returning to work part-time again on Monday. And so having a great boss. And also having my own disability insurance when I was in private practice on my own, with my own practice in the city previously, I kept it. And so that has been a lifesaver, which I recommend to every and anybody, have disability insurance, because you never know when something happens, and you need to know that you can take care of yourself and your expenses and your family.
Right. For me, radiation, I went to an old white man doctor. He didn't tell me nothing about skin. And
Sounds about white.
I'm a summer baby, you know, and I was in the sun, and no one told me don't go in the sun.
Mm-hmm.
No one told me, like, you know, he didn't tell me anything and any about the symptoms. And I had to finally learn from my breasties, Ricky, what are you doing going in the sun? Are you crazy? And like, you know, and what creams to use and what products to use to help me. But I got nothing from my doc. So, you know, we have to, and after figuring out that my skin was burning, you know, I had to go find some help, right? But we get it from our breasties, so.
I think as surgeons, we can really do a better job of talking to patients also about their skin, especially Black patients and brown patients, because we don't take into account, you know, and one of the things I always do is sit down and talk about scars. How do you scar? Do you know how you scar? Because chances are you do. That can help me know where to put your scars. It can help me understand better the texture of your skin, and what we need to do for you. But the other piece is that, you know, many of us Black women are not offered lifts, reductions, reductive surgeries, which can make radiation easier. So if you are a very, very large breasted or a very generous breasted patient, and you have a breast cancer, you know, probably 8 times out of 10, bordering on 9 times out of 10 now, your insurance will cover a symmetry and a reductive procedure. You meet criteria for a reduction and a lift if you so chose. And what that does is it relieves you of some of the breast tissue. So yes, there's less to screen moving forward in the future. 2, it can make your nipples match and you have symmetry, but it also makes radiation easier. And when surgeons don't offer this to patients, it's a bug in my craw, because, you know, it's something that it's covered. Why wouldn't you? So I always say, do you have neck pain? Do you have back pain? Because guess where you end up feeling the effects of radiation? Underneath of those pendulous breasts, at the bra line, at the places where radiation hits you, and those are moist, damp areas. And that's a really tough thing. When your skin starts peeling as a result of radiation, you start to get that, we call it moist desquamation, and your skin looks like it's peeling like a sunburn. It doesn't feel good. It doesn't heal well. And I just feel like we could all, as a community of surgeons, even like that, talk about radiation should start in the surgeon's office. You shouldn't have to wait till after surgery, after chemo, or after whatever, and, you know, to finally start having somebody address your skincare needs, you know, because it should be included up front. And that's what I mean when I say, you know, what are people telling you, and what do you wish you had known? And I want to switch gears. We got about 15 minutes or 20 minutes or so to talk about advocacy and activism and the transformational experience of this breast cancer, because I see it through Ricky every day, how this has completely transformed her outlook on life and what she does for people, for patients, for breasties, for advocacy, for research. She's all over it. And so I want to start with Dr. Dakota, and then I'm going to go to Shaquita Estes and Ms. Estes to talk about, you know, how this changes your conversation with your patients too.
Absolutely. I didn't know how to, I mean, at a certain point I started wearing a mask. This was even prior to COVID. And so I had patients look at me like, why is she wearing a mask? You know, what's wrong with me? And I didn't know how to reach, how do you start that conversation? Do I want to share that conversation? Should I share that conversation? Will patients want to come to me? Will they not? I had no idea what was going to happen. I'm a Christian. I left it to God and said, I'm going to tell them. So I had a patient, I was running late and I wasn't feeling well that day. And he had like a meltdown in the office. And when I told him, he looked dumbfounded, number one. And then another patient came in, he was like, we need to leave her alone. She needs 10 minutes to herself. And it just changes the way people look at you and become a little bit more sensitive. I obviously, being, as you're talking about doing surgery, what have you, I'm known for cosmetic incisions. I published a paper on it. So definitely I'm an advocate for that and talking to patients about how does your skin heal? What does it look like? Girl, we're going to hide this. You could be keeping those sandals in the summer. And so I tried to do that where if they're wearing a sandal, you know, yeah, you fix a bunion deformity or whatever, a fracture, but can they look attractive as well? I was blessed that my doctor got out of her own way. She wanted to put the Biosorb implant, which looks like a helix. and it goes in. And as we know, sometimes, especially on us, those things do not dissolve when they say 12 months. Sometimes it's never, or it's 36 months. And she got a plastic surgeon who said she needs no implant. I've got this. And I was like, God is good. Thank you. Because I was not going for it. In addition to the fact that I suffer with a lot of allergies. So that was a fear. If it doesn't dissolve, am I going to be reacting to this? And now we have to go in for a second time. So yes, knowing about lumpectomies, did I have to have a mastectomy? No. Knowing about, what about my scar where they did it periareolar or around the nipple so that the scarring, when it heals, looks like nothing. I mean, literally. And also they did a fat graft where they went under my armpit, which the scar looks fantastic. I can barely see it myself, and transferred that into the breast so that my breasts look normal. Not knowing that, which a lot of people just don't know unless you're in the medical field, and then having somebody know that you know a lot of things changes everything. So from an advocacy perspective, I want to be just like how my friends were who came and supported me, to be an advocate, to go with somebody who for chemo. If you want to go to the doctor's office, I want to be right there and let that doctor know. Absolutely. I had a second opinion from Sloan Kettering with my sister, and my sister's an attorney, big time attorney, and she looks young. And the doctor barely even acknowledged her. And my sister had to check her, and I checked her, and she was like, oh, adriamycin. At the time, I had hypertension. And I told her, I said, well, you tell my sister that you can throw me into heart failure on adriamycin. Oh, yeah, that's true. It's a possibility. Can you tell her side effects? Oh. And all these things kept going. And I said, all I need to know is, do you agree with what my group wants to do? Yes. Do you know my surgeon? Because she's Sloan Kettering trained. Yes. Then I don't need you. And I'm glad that I advocated for myself and pumped and asked those questions where they weren't willing to give them up this season.
But you were able to because you're a doctor. Think about
That's exactly right.
A doctor or somebody who really doesn't know anything, And
that's why I would say, for me, my advocacy is, if I know someone who has cancer and they want to share that story with me, and I'm doing that with a friend of mine right now, I want to go ask these questions. Right? I even do that for regular stuff. I'm sure Monica's the same thing. Oh, I'm going to go have knee surgery. What should I ask the doctor? And I'll tell them. And the difference is night and day, where they start off and they look at us like Black patient. And when they start coming with those questions, 9 out of 10 times the doctor goes, oh, you must have a doctor in your family. It's exactly right. It's exactly. And the conversation and the detail changes dramatically. And that's what I want to be. Besides advocating, even writing a book like Shaquita did, and, joining different groups to make sure that they know that we're out here. There's doctors who are Black who look like you will have your back, and make sure that you're getting the right care, asking the right questions. So if your doctor can't answer them, you can walk away and find, like you did, Ricky, somebody better.
I hope that's what this show is,
that I'll share at the end. I have a great idea. I'm going to put you guys to work.
Okay. I love it. And I love that you said that, because that's what I hope that this show is. And that I hope that's what it does, is that it becomes a place where breasties and caregivers and people who are facing this diagnosis can come and get some useful information, things to ask, and I think, Ricky, we can do a better job of providing things after the show and a resource. And, our webpage will be up soon, I promise you. And you can go and you can say, hey, can I get a checklist of things I should ask for when I go to my chemo, my first medical oncology appointment, or I'm going to see my surgeon, I had a positive biopsy. What do I need to know? And I want to be like, the breast surgeon in your pocket, so that if I can't be there in every exam room and every consult, but you can say, you know what, I have somebody, and then I have some breasties, I have some people who, have given me some things to ask and think about, so that you don't have to sit there and do all that research and try to generate it yourself while you're still just trying to wrap your head around your diagnosis and what's going to happen to your kids and your summer vacations and your jobs and the elderly parents you're taking care of, and, all the things. So I hope that this moving forward does become that resource and become that breasty, and that, Ricky, I see the wheels. I smell smoke. I smell the smoke of your brain at work, and I'm excited about it. But Shaquita, talk to us about how this changes how you take care of patients, and also about, the activism and stuff that you do, the outreach that you do.
I think for me, it just really puts a different perspective of how I love on my patients, even though I have little pediatric patients, but really just loving on the parents too, and really, being there to provide any information that I can. Surprisingly enough, in my profession, and I guess in my openness, I had a patient, a parent who actually went through breast cancer, and she shared some things with me. And I would have never done that at work, with a patient, but she was so open and honest. And I said, this is what I have to do. This is what this calling is for, that God has called me to do. So one way is through the book and really talking to other, breast cancer patients, because I feel like hair loss is a big thing. And so I've been trying to get with other breast surgeons here in Georgia, and then even you, Dr. Monique, and just trying to get the book out there to really help other moms, because that was one of the hardest conversations that I've had to have with my children, is to tell them that their mom was sick and was getting ready to go through something. I broke down, but it took a certain level of strength as well for my husband and I to be on one accord and really sit them down and have that conversation. And I want other parents to know that it's a doable conversation, and it's a conversation that you don't have to be afraid to have, because I feel like if you're open and honest with your kids and you share some good knowledge with them and put it in layman's terms for them, that then they will have a better understanding and they won't be fearful of your mom. My daughter was very scared to touch me and these kinds of things, where I was able to really open up and share with her as a female to a female, like, this is what mommy's going through. And she actually wanted to see my scars and things. So this opened the doorway in the segment for us to really have that conversation. So I really want to talk to more female, women and mothers who are going through that. So that's what I'm advocating for moms, because we need a sense of normalcy as well. We want to keep our house and things running as much as or have normalcy as much as possible, so that we don't feel alienated and that we're not involved with our children. And also to touch to doctors to really have something for them to say, here's a book, here's some way. So I've been doing some talks. I did some things during Breast Cancer Awareness Month last year. My goal is to do some more talks this year, because I think the more we talk about our stories and we share with other people, that more women will come up front and be open about it. And I feel it's not until you get into this situation that you're able to do that, but I was led to share. So if you follow me on Facebook, my Facebook followers know that I'm going through this journey, and you'll be surprised to know how many of my friends have now had other people who diagnosed with breast cancer, and they call me and say, hey, Shaquita, do you mind talking to my friend? And it's absolutely, I'll talk to them. So really having that sister to sister girl chat, to say, hey, come on, be a part of my Tata Truth. And I'm here to answer any questions that I can. And if I don't know the answer, I'm willing to help you find the answer. So I think that's a part of what I'm advocating for, that sister locking arms with other sisters and really saying, hey, I've got your back. I'll help you go through the process, that somebody is there to be in the fill the gaps when you're weak and you're having a bad moment.
Monique, just a quick tag on to what she said. Having, I'm seeing a question in my little chat, and they're saying, how can people help? Helping is having advocacy groups. Helping is like our sorority has a group for sorority sisters who have cancer, those who are active, the warriors, those who have survived, and those who are supporters. And that has been everything to me. So Yasmin Coleman, she knows I can say her name. Everything, because I can talk to other Black women and my sores at that. Like, girl, what about so and so and so? Because I don't know everything and I don't have all the answers, and it's not my specialty. Mm-hmm. It's great to have, telling people, and I think again that you need help. I have also a blog called the Caring Bridge site, which is dedicated to cancer patients, that my big sister in medicine, Suzanne Greenidge, made me do as a result of her sister passing away. And I can't sometimes call everybody, and I'm tired. It's easy to go on there and say, this is what my day was like. This is what I need. For example, I needed sweatsuit things for chemo so I could zip down and not show the world everything. And Soars and friends sent me that. People sent me teas. I've had beautiful baskets from the Ivy Socialites for my Soars Sabrina. I've had my best male friend, Junior, who flew in for my second chemo. Things that I didn't think, you don't know what you need until you need it. So I think the best thing for your family and friends to do is to ask you. Don't just be like, call me if you need something. It's never going to happen with a type A personality. It's like, show up. Like my girlfriends did, Passion and Jennifer. Fold my clothes, bring me some food, send me a gift certificate like my alpha brother did. I mean, you just have to show up for these. And even when we fight you on it, deep down we know we need it and we're thankful for it. And your family just being like, I'm here no matter what.
Yeah.
So you guys, today, I started a new foundation, and I'll tell you more about it as time goes on, but it's called Touch, the Black Breast Cancer Alliance. And the website will probably be up next week, but our social media is up, and our social media is at Touch, the word Touch, TOUCH, BBCA, Black Breast Cancer Alliance. And we're going to focus on Black breast cancer, but you gave me a scathingly brilliant idea. So I think what we're going to try to put on the website is the Breasty Guide to Breast Cancer.
Yeah,
absolutely.
Right.
I love it.
And maybe we'll even do a page for Breasty Docs. So
love it.
The Breasty Doc,
great.
Breasty Doc Bible. So all of you guys should like our social media. The website will be up hopefully by next week. But if you have anything you want to put on the Breasty page, we'll make it all based on stories of our own stories, our own experiences. So our email address is you can do Ricky, RICKI at touchbbca.org. And you guys can reach me on Twitter too at Ricky Dove, but all of our social is at touchbbca. Send me a story. Send me your advice. Send me how you felt variation, and we'll start to build this Breasty guide. And we can help our sisters by talking to how it made us feel.
Not only that, Ricky, I want to jump in because we've had a number of questions about finding Black doctors. Somebody said, I wish I had a Black physician.
Right.
I wrote it back. I said, we out here. I promise you we are. And having a place, we are out here, whether it's podiatry, whether it's pediatrics, whether it's dermatology, oncology. There might not be a lot of us in oncology, but we are out here. And you can reach us, and through telemedicine, you can reach us more and more. And so, putting together something like this is going to be really, really powerful for our patients. The other thing I want to jump in and I want to say, if you go to, your Look Good, Feel Better, you go to your support groups and places, and they do not have books that look like you. They don't have information that is relevant to you. There's no Black, no brown faces. There's no translation in your language. Ask for those things. So for people who are saying, what can you do? Guess what? You can ask your hospital to get these. And Shaquita, you've been asking me, and I'm working on it. I promise you I am, to get more of these into our hospital and into your hospitals. Ask your navigators, ask your social workers, because this is something that they can purchase in bulk. I'm sure she'll give you some kind of bulk discount, but get these books so that you can talk to your kids, talk to your family, so you can support your breasties, and so that you can have representation, because representation matters. It matters so, so much. And you've taken the time to write this book, and I want people to support you, to go on Amazon, go on your social media and find you, and, use this as a resource, because that's why we're doing this, and it's hard as providers to always get back to everybody. But I promise you that people who write me, I try to write them back. I try to answer questions as best as I can, because we have to be our sisters' keepers. So tell us again how we can find you and follow you on social media, because I think we got to get ready to wrap up. This has been really quick and short and just so, it's been a love fest. But tell me again how we can reach you and get the books, and we're going to go in reverse order.
Okay, go first.
Oh, Ricky, go ahead.
No, you go ahead. Go ahead, Shaquita. I just said.
Okay, so I'm Shaquita Lewis Estes on Facebook. On Instagram, it's Shaquita_Estes. You can purchase the book on Amazon, but if you purchase through my website, my daughter and I are giving you an autographed copy, which we love. We write special notes, trust me. You can go to www.quitaquest.com. Yep, there's that special note. Again, that's www.quita, QUITAS, quest, QUEST.com. and purchase your copy there, and we will get it off to you as soon as possible. I enjoyed it. I've enjoyed this segment. Thank you guys, and please look me up, Shaquita Lewis Estes on Facebook.
Can you put your information in the chat, and then
Yes, I will.
after the show, and then also, how about you and your daughter make a video for me, like a little video commercial? I'll post it on our Touch BBCA Facebook and Twitter and Instagram.
I love that.
And make a commercial for you guys.
Oh, love that,
We'll
Ms.
post it,
Ricky.
put it on-
Yes,
you guys
I
can-
appreciate
I'll
that.
post everything on the Touch BBCA social media.
Yep.
Okay, great.
Okay.
Dr.
Thank
Dakota, how can people find and reach you?
As a podiatrist, you know, there's a lot of us. I actually formed Sisters in Podiatry. We have over 200 members across the United States of Black female podiatrists who are out there. On Facebook, Sisters in Podiatry, Google it. Personally, I have friends, and you can be a friend, under Kordai, K-O-R with the space, D as in David, A-I. Professionally, you can find us at www.orangeheartcenter.net. Again, orangeheartcenter.net. And my business email is my last name, Decoto, DECOTEAU @orangeheartcenter.net. I'm Googleable easily because of the name Kordai Decoto on social media, and also more so just with Google to find me. And I'm always up for questions. If it's not related to podiatry and it's to the breast, absolutely. And we're here. As Monique said, Dr. Mo, we are here. Black.org, we're listed, and we're here. And we're here for you.
Right.
We
So
didn't even get to talk about foot care and how important it is in the Black community, and neuropathy and all that. We'll have to have you back to talk about that, because we get a lot of questions about treatment for neuropathy and also for skin care. So for those people who put that in the comments, I definitely hear you, and we will do a segment on skin with Yolanda Lindsay, who is a wonderful dermatologist who can talk to us about alopecia and skin care for women of color. And so we'll get into that, but to have you back and talk about the importance of foot care will be really nice. Ricky, you're up.
So yeah, so you guys know how to reach me at Ricky Dove, but check out Touch BBCA at Touch BBCA, and you can call Ricky. You can go on our Facebook, our Instagram, whatever, our Twitter. We'll get right back to you. We'll look for more stuff next week. And you know, next week, Dr. Mo, we're going to talk about clinical trials.
Yes, we are, and it's going to be good. I'm Dr. Monique Gary on the Facebook, the LinkedIn, the Twitter, the Instagram. They got me with a new YouTube channel, and so you can watch the replay of this on there. You can follow me on social media. I want feedback from people. What shows, what ideas, what topics, what do you need to hear? And that way we can bring it to Touch, we can bring it to you, and give women what they need, because COVID doesn't look like it's going anywhere anytime soon. So we have to stay connected as best as we can. So we hope that this has been relatable, reliable, and real, which is what we plan for it to be. So when we say the doctor is in, we out here and we in here and we're bringing it to you. And I thank you for watching. Thank you for joining us. I love you guys.
Breasty love, big hugs. Thank you guys.
Take care.
6 o'clock on Wednesday. Bye.